Hello, my dear doctor. Good evening, everyone. This is Dr. Azam here, your faculty of anatomy at PrepLadder. And today we are going to actually discuss the recall questions of INI-CET November 2024, which was conducted yesterday. And now we are going to discuss all the questions which has been asked in the anatomy here, my dear friends. And of course, in this, the questions discussed in this PPT will be just the recall base, and the motive of this is to get the actual question asked in the exam. And we are just going to see like what were the topics which were mainly asked in the exam. And the final questions, of course, we are going to upload that on the PrepLadder app. Okay. So now let's get started with the questions which were asked in the exam one by one. So the first question that we're going to discuss here, a simple question which was asked: in human sperm cells, the mitochondrial sheath is present in which of the following portion? The middle portion, or the connecting segment, or the tail, or the head? Of course, everyone knows very well, if this is the structure of the spermatozoa over here, you can very clearly see the mitochondria are mainly located in the middle piece, the middle portion of this one. So answer for this question here will be the middle portion. Now moving ahead with the second question, this question was like a very simple one. Now moving on to the next question here. While walking, which of the following muscle on the supporting leg helps in stabilizing the pelvis to support the lifted leg? And of course, this concept we have discussed a lot of times, and especially like we have discussed this in the recently rapid revision session which I have taken on the PrepLadder app. So that is all about, this question is all about the Trendelenburg sign and the lurching gait that we have discussed. So while walking, for example, if the right foot is on the floor and the left foot is off the floor there, I have discussed in the rapid revision session that what is going to happen if the left foot is on the like if the left foot is off the foot there, of the floor there, then what is going to happen here? The left side of the hip will try to sag, it will try to drop. So therefore, that is prevented by the contralateral side gluteus medius and minimus. Contralateral side gluteus medius and minimus. Yes, that will be the supported leg, the supported side there. And we have discussed this one recently here. So obviously, out of the four options which are given here, vastus medialis, gluteus maximus, gluteus medius, and tensor fasciae latae, the correct answer here will be the gluteus medius one. So while walking, which of the following muscle on the supporting leg they have asked here, on the supporting leg, helps in stabilizing the pelvis to support the lifted leg? Yes, of course, absolutely correct. It is gluteus medius here. Now moving ahead with the next question, my dear friends. In the posterior interosseous nerve palsy, which of the following function is primarily affected? Now, when you learn about the radial nerve, first of all, it is actually a branch which is coming from the posterior quarter of the brachial plexus. And that radial nerve, which is going to begin from the axilla, and from the axilla, it is going to pass behind the shaft of the humerus in the spiral groove. And then from there, it is going to the lateral aspect of the arm. And there it is going to again divide into two branches there, the superficial branch and the deep branch. The superficial branch and the deep branch. And out of that, remember, the deep branch is the one which is going to pierce supinator muscle, and it is going behind the forearm. And therefore, that is going to continue as your posterior interosseous nerve. Now, that posterior interosseous nerve is mainly supplying to the extensors which are present in the forearm, the posterior compartment, the muscles present in the posterior compartment of the forearm. And in these muscles, one of the muscle here will be the extensor digitorum muscle, and that is going to help in extending the digits, Okay, no, it's not about flexion, it's about extension of the digits here. And remember, my dear friends, at the wrist, flexion here and the extension here, extension at the wrist here, mainly it is by ECRL. So I have said you this recently in the recently conducted rapid revision session. I told you that ECRL is the one which is mainly helping in extension at the wrist joint. So you have to observe here very carefully. If ECRL is gone, then what is going to happen? Wrist drop will occur. If PIN is gone, then what is going to happen? Extensor digitorum muscle is gone. It will lead to finger drop. So that also we have already discussed here. Posterior interosseous nerve injury, it will actually lead to finger drop, not the wrist drop. So therefore, my dear friends, in the given question, in posterior interosseous nerve palsy, which of the following function is primarily affected? Wrist flexion? No. Wrist drop? No. Extension at the wrist? No. It is actually about the extension at the fingers. Extension at the fingers will be affected if PIN is gone, because PIN will be supplying to extensor digitorum muscle, and that is helping in extension at the fingers. If that is gone, it will lead to finger drop. Perfectly fine here. So already this concept also has been discussed, guys. And absolutely the same question again, just the wording's a little bit different over here. In the injury to the post-interosseous nerve, it will lead to which of the following deficits? Yes, of course, will not be able to extend at the fingers, loss of finger extension. I hope you're able to recall these questions which were asked yesterday in the INI-CET exam. Yes, perfect, perfect, perfect. Absolutely correct, Dr. Rajesh. Yes. Then one of the question which was actually in integration of anatomy and radiology, and which of the following artery is indicated by the arrow mark in the given image? In this given image, you can see the artery is like more towards the lateral side, and that artery is actually the superficial temporal artery. Superficial temporal artery. It cannot be the middle cerebral artery, and basilar artery is totally different there. Vertebral and vertebral artery will combine together to form the basilar artery in this diagram here. And it can't be the internal carotid artery. That is towards the lateral side over here. That is actually the superficial temporal artery. Perfect. Next, moving on to the next question. At birth, in which of the following stage of meiosis is the oocyte arrested? Whenever I taught about the gametogenesis, when we learn about spermatogenesis and oogenesis, I have always said the students in oogenesis, 2 points are very much important. We need to understand and learn primary oocyte will be arrested in which phase and the secondary oocyte will be arrested in which phase. So here they're asking at birth. At birth, obviously, it will be in the primary oocyte. And that primary oocyte will be actually arrested in the prophase 1. This primary oocyte will be arrested in which phase? Arrested in prophase 1. And now if you look at the options there in the prophase, also they're asking like which stage of this one here. So please remember in the prophase 1, it will be arrested in diplotene stage. Diplotene stage over there. Okay. So at birth, first you have to remember that the oocyte will be in the form of primary oocyte, and the primary oocyte will be arrested in the form of prophase 1, and in prophase 1 it will be arrested in diplotene stage there, guys. Now moving on to the next question. Which of the following are the derivatives of the neural crest cells except one? This is like a beauty of INI-CET exam. One thing I'd like to tell you that INI-CET one of the beautiful exam. Why? Because it is like very well balanced. Like good number of questions are also going to come from the first year and second year subjects, the preclinical and paraclinical subjects. Definitely they'll be asking. And the good thing about this exam is that always we have set of like very important topics from where the questions are going to be asked. So definitely one question will be there from the upper limb nerve injuries that we have discussed just now about the PIN injury. And yes, of course, they'll be giving good number of questions from embryology also. And neural crest cells, like definite things. These are like certain definite questions asked in the exam. So all of the following are the derivative of the neural crest cells. Yes, ciliary muscles, perfectly fine. But a retinal pigment epithelium, no, it is not derived from the neural crest cells. Almost all the ganglions, ciliary ganglion is derived from there. Yes, of course. Adrenal medulla is also derived from there. If you have learned about the adrenal gland will actually have two parts. One is the adrenal cortex, another one is the adrenal medulla. In adrenal medulla is also referred to be as a modified ganglion only. So remember, even that is also derived from the neural crest cells, but not the retinal pigment epithelium. So already that has been discussed about the neural crest cells derivatives. We have discussed recently in the rapid revision session also. Perfect, my dear friends. Let us move on to the next question right now. An old man presented with bad breath and the long-standing dysphagia since 7 months. X-ray image is shown below. What will be the diagnosis? Yes, another important thing about the esophagus, definitely they'll be giving one question always. In INI-CET, what I have observed from like so many years about the esophagus, they'll be giving one question. But this time they have given about the Zenker's diverticulum over here. So this diverticulum here, the Zenker's diverticulum. When it comes to the anatomy part, yes, I have discussed about this one in detail in the rapid revision session, my dear friends. We know that very well when you learn about the wall of the pharynx. In the wall of the pharynx, you'll be having constrictor muscle. Superior constrictor, middle constrictor, and inferior constrictor. The inferior constrictor is in turn made up of two muscles. One will be the thyropharyngeus, another one will be the cricopharyngeus. Now, between the thyropharyngeus and cricopharyngeus, you'll be able to find an area of weakness, and that weak area is actually from where the outpouching will be formed there. And that will be the Zenker's diverticulum. And that weak area is referred to as the Killian's dehiscence. We have already discussed about this one here. And yes, of course, this question was asked in the INI-CET exam over here. So the answer for this question here is Zenker's diverticulum, my dear friends. Now moving on to the next question here. Which of the following cranial nerve is not the content of superior orbital fissure? Superior orbital fissure. So when you learn about the superior orbital fissure between the lesser wing and the greater wing of the sphenoid bone, you'll be having superior orbital fissure. And that superior orbital fissure is the one from where the cranial nerve number 3 as well as the cranial nerve number 4, trochlear nerve, as well as the cranial nerve number 6, abducens nerve, along with the branches of 5-1 ophthalmic nerve will be passing from there. 5-1 branches. And what are the three branches given by the ophthalmic nerve? Number 1, there will be frontal nerve. Number 2, there will be nasociliary nerve, as well as there will be the lacrimal nerve. Okay. And along with all these nerves here, the cranial nerve number 3, 4, 6, along with the branches of 5-1, along with that, there will be ophthalmic veins passing from here. Ophthalmic veins will also pass from the superior orbital fissure. Fine. But yes, my dear friends, please remember that here the important thing, if you want to learn in depth, is there will be a ring of Zinn here. Ring of Zinn. Now you need to learn what are the structures which are going to pass inside the ring of the Zinn and outside that one. So one of the best mnemonic for this one is LFT. LFT is left outside the ring. LFT will be left outside the ring. So L stands for the lacrimal nerve, and then F stands for the frontal nerve, and then T stands for the trochlear nerve. So please remember LFT is left outside the ring. So in this, my dear friends, remember the lacrimal and the frontal and the trochlear, these three will be left outside. Remaining all the nerves, that is your third nerve, oculomotor nerve, and then the abducens nerve, as well as the nasociliary nerve is going to pass inside the ring only. And of course, even in the oculomotor nerve also, if you learn in depth, directly oculomotor nerve, the third nerve is not going through the superior orbital fissure. Just before that, it will be divided into two divisions. One is upper division, another one is the lower division there, guys. Perfect. So which of the following cranial nerve is not a content of the superior orbital fissure? All of them are the content, but not the second one. Optic nerve will be actually passing through the optic canal separately there, guys. Perfect. Dr. Priyatosh was telling it was an image-based question. Yes, of course, Dr. Priyatosh. We also have like one image-based question on this one, where they have asked about the oculomotor nerve. I'll even discuss this one. But some of the students have also mentioned about the superior orbital fissure also. So I have included that one. Yes, Dr. Raymond. Thank you, Dr. Babar. Thank you. Yeah. So optic nerve is not going to pass from here. Now, yes, of course, we have discussed in detail about this concept regarding the superior orbital fissure, the ring of Zinn, like what are the structures passing inside the ring and then outside the ring. I have discussed everything in detail in the recent rapid revision session that I have done at the PrepLadder. Fine. Now moving ahead with the next one. Yes, one of the hot favorite question nowadays in almost every exam, my dear friend. Not only INI-CET exam, this question is being asked repeatedly almost in every exam, whether it is INI-CET or NEET PG exam or the FMG exam. So please learn this concept very well over here. Which structure lies beneath the arrow marked structure? Of course, we all know it is Pterion. And Pterion is actually formed between the four bones here. It is actually a H-shaped suture, and that is formed between the frontal bone here. And this one here will be the parietal bone here. And this one here will be the temporal bone. Yes, of course, it is the squamous part of the temporal bone. And this is the sphenoid bone here. And that is the greater wing of sphenoid. Frontal, parietal, squamous part of the temporal bone and the greater wing of the sphenoid. Between them, this H-shaped suture is known as the Pterion. Now, what we have to learn here is that what are the structures which are going to lie deep into the Pterion? Yes, out of all these options, yes, the correct option here, let me first of all tell you here, the stem of lateral sulcus. The stem of lateral sulcus is the right option. Of course, pineal gland cannot be present over here. We have learned about the pineal gland in the posterior wall of the third ventricle. In the posterior wall of the third ventricle. So it is like way behind. It is not just beneath the Pterion here. It can't be the option. Internal carotid siphon, no, this can't be the option. And Wernicke's area, not exactly here. It will be located on the superior temporal gyrus, but posteriorly. Wernicke's area will not be present here. But yes, of course, if they have given the option as Broca's speech area, then yes, that option would be the right one. But Wernicke's speech area is not present deep to Pterion. Yes, Broca's area might be present over there, of course, on the dominant side. We know that one. Now, please look here, all the relations which are present deep to Pterion. Yes, of course, exactly the same thing we have discussed recently in the rapid revision session, my dear friends. You can clearly see here in the Pterion, what are the relations of the Pterion? And yes, we have seen here uh, right at the Pterion, the lateral sulcus. You can see in the image here, the stem of the lateral sulcus will begin from there, which is also known as the Sylvian fissure. Sylvian fissure. So we have recently discussed this one over here, my dear friends. Next one. Now, once you are done with this one here, let us go ahead with the next question here. Identify the mark structure in the given image. Identify the mark structure in the given image. Yes. So students have said that exactly this image was given. Yes, exactly this image was given. And in this image, you have to identify the mark structure. My dear friends, the moment you look at this image over here, yes, of course, it is actually about the development of neural tube. Development of neural tube. This is another very important concept from where the questions are being asked in every exam, almost every exam. Even in FMG exams, the students who are preparing for the January 2025 FMG exam, yes, neural tube development is very important, my dear friends. You can, I can assure you that one question will be coming from the neural tube development, neural tube defects. One question will come. So if you're preparing for the January 2025 exam, my dear friends, please learn this topic very carefully. Apart from that, I'm also going to help you with the LRR session, which is scheduled on 16th November. Within couple of days, I'll be helping out with that one also. Fine. So neural tube development, very important topic. Now in this one, we are actually able to see there the neural tube is forming. Now in the neural tube formation, what is going to happen here? I taught you with the help of these three diagrams here. In this diagram, the blue colored line above there is ectoderm, and the red colored line below will be the endoderm, and in the middle you'll be having the mesoderm. And the notochord is going to induce the overlying ectoderm. Now, once the ectoderm will be induced there, it is going to form the neural plate. The ends of the neural plate will be forming the neural fold, and then those neural folds are going to come closer, and finally they are going to merge, and it will result in the formation of the neural tube there. So basically, in this exam, they have asked you about the ends of the neural plate. That is nothing but the folds, that is neural folds. And yes, of course, this diagram already we have seen in our classes when we will be able to see the formation of the neural tube from behind. That is actually the neural fold here. So the right option for this one will be the neural fold. Of course, always there'll be there'll be one question from the development of the neural tube. That is very much important. Please take care about that one. Apart from that, like if you are like well aware about the previous year question, one more important is neural tube formation begins from where? The neural tube formation begins from which region? That is another very important question, has been already asked in the NEET PG exams also. Please remember, when the neural folds are going to fuse together, the fusion begins in the cervical region. The neural tube formation actually begins from the cervical region. First, they're going to fuse in the cervical, and further that fusion continues cranially also, as well as caudally also. Please remember that point also, it's very much important. Apart from that, I hope you all are very much perfect about the cranial neuropore and the caudal neuropore. Cranial neuropore closes on 25th day, and the caudal neuropore will close on 27th or 28th day. Yes, apart from that, the defects are also well known. Hai na? If there is a failure of closure of the cranial neuropore, it will lead to anencephaly, and failure of closure of the caudal neuropore, it will lead to spina bifida. Fine. So just I'm trying to revise all these points here. Why? Because this topic is very much important. The students who are listening this video right now for preparing for your next upcoming exams, so please revise all these topics, my dear friends. Now, moving on to the next question. Yes, I think Dr. Eman was asking about this one here. Dr. Eman, which of the following cranial nerve is marked in the given image? You were telling about this image here. Now, in this diagram, my dear friends, if you observe here, the arrow mark is on this nerve over here, and this nerve will be actually the oculomotor nerve. That will be the oculomotor nerve. That is the third nerve. Oculomotor nerve. That is the third nerve, sir. Dr. Leba Mehtab, sir, my anatomy was so weak, but your rapid revision was a game changer. Thank you for that. Now, once again, my dear friends, everyone please look at this image very carefully here. Now, in this image, any student can easily identify this nerve which is going to pass through the cribriform plate. Now, this nerve here will be the cranial nerve number 1, olfactory nerve. Anyone can identify that one. The next thing is this nerve which is going to pass through optic canal. This is the cranial nerve number 2, that is your optic nerve. Anyone can identify. In all my classes, even during the recent rapid revision session, I told many students that you have to actually be able to identify these 3 nerves over here. Always in the exam, they'll be testing you on these 3 nerves only. Confusion will be here itself. So please concentrate here. This is actually the cranial nerve number 3. And in this diagram, this nerve over here will be the cranial nerve number 4. Now I told you during the classes very clearly, my dear friends, that midbrain is the one from where the third nerve and the fourth nerve is going to begin. Third nerve and fourth nerve is going to begin from midbrain. And I hope every medical student remembers very clearly the only cranial nerve originating dorsally will be the fourth nerve. The only cranial nerve having dorsal origin will be the fourth nerve. So for example, if this one here will be your midbrain here. So from the midbrain, third nerve will be actually having ventral origin. But the fourth nerve will actually have dorsal origin. And because of that, it's going to take a turn and come from here. Oh, that's how I have asked you always to remember that. Third nerve will be having ventral origin, entering into the superior orbital fissure. But fourth nerve will actually have dorsal origin. Then it is going to take a turn and come. So that has to be the fourth nerve. And then what about this nerve over here? What about this nerve here? That nerve is actually climbing up. It is coming up from that slope, and that slope, like region over there, it is known as clivus. That nerve is coming up from the clivus. Now, I hope you all remember 6th, 7th, and 8th nerve. These 3 nerves are at pontomedullary junction. 6th nerve, 7th nerve, and 8th nerve are at pontomedullary junction. So therefore, what is going to happen? If this is your midbrain, below that pons, below that there will be medulla oblongata. So from pons and medulla, pontomedullary junction, from there begins the 6th nerve, and it has to climb up through the clivus. And then that nerve is also going to enter via superior orbital fissure, and it will be going and supplying to the lateral rectus muscle. We know that formula SO4 LR6 rest all by 3. So lateral rectus will be supplied by 6th nerve. So the nerve which is actually climbing up from here, the moment you see that nerve in your future exams, whenever you're going to write down the exam, if you see this nerve climbing up the clivus, that is definitely your 6th nerve. That is the way how you have to identify. Apart from that, remaining nerves, my dear friends, anyone can identify. It's all about identifying these 3 nerves. If you have observed the previous year question, you observe there, always they're asking out of these 3 nerves only. Out of these 3 nerves only, somehow, some other question will be asked. So you should be able to identify these 3 nerves perfectly. Okay. So that is third nerve, fourth nerve, and the 6th nerve. So which of the following cranial nerve is marked in the given image here? Of course, that is the third nerve, that is oculomotor nerve here, sir. Okay. Dr. UK, sir, in the question, they pointed primitive streak. Yeah, I got this feedbacks also. Like some of the students are actually saying the arrow mark was little bit behind on the primitive streak. And some of them are telling that the arrow mark was on the neural folds there. So we know the concept very well. We'll be able to identify. So in this, I have just kept it at on the neural folds there. Of course, the arrow mark behind, of course, it will be the primitive streak. Fine. Next one. So yes, in this question, the answer here is oculomotor nerve. And you can actually go back and refer to my rapid revision session. In rapid revision session, I have trained all the students how to identify each and every nerve in that one. In the cranial foramens, each and every nerve, how to identify them. Yes, it is already done there, sir. Moving on to the next question. A patient complains of stucking of food between the cheek and teeth. Which of the following muscle weakness is associated with the presenting condition? Yes, in the cheek here, you'll be having Buccinator muscle. Buccinator muscle is the one which will be helping in blowing the cheeks, something like this here. So if the person is not able to, remove the food which is stuck over there, it is of course because of the weakness of Buccinator muscle. Weakness of Buccinator muscle. We have studied this concept at 2 places. Number one, I'll tell you one thing here. I have taught you about the muscles of mastication. In muscles of mastication, I taught you about one point known as accessory muscle of mastication. Accessory muscle of mastication will be Buccinator muscle. And that is why it is known as the accessory muscle of mastication. I taught you during my classes that whenever some food is stuck in the space between the cheek and the teeth here, we are going to put our tongue there and remove the food from there. And while removing that, which muscle is going to help you? Buccinator. Practically in the classes, I have shown them, yes, we are going to put our tongue over there, something like this, and then remove the food from there. You know? So that is why buccinator muscle is referred to as the accessory muscle of mastication. So it's very simple to answer here. If the food is stuck there, yes, which muscle weakness is there? That is nothing but the buccinator muscle. Apart from that, my dear friends, please remember here, once this is done here, apart from that, yes, of course, this same thing, same points, we will also be learning when we learn about the upper motor neuron and the lower motor neuron lesion of the seventh nerve, the facial nerve. Bell's palsy. We have discussed about all these conditions, the drooping of the saliva, stacking of the food over there. The angle of mouth will be going down. So I request all of you to please refer to the rule of 17. I've explained very clearly all the nerves. Most of the students have observed that they'll be confused between the deviation of the tongue, the deviation of the jaw, the deviation of angle of mouth, the deviation of uvula. So all these deviations related to the cranial nerve number 10 and the cranial nerve number 12, the cranial nerve number 5, and then the cranial nerve number 7. And for this, there is a beautiful rule of 17. Please refer to that one. This type of questions, you will never make it wrong in that one. I hope this is very clear. Now, once you are done with this one here, the first migration of epiblast leads to the formation of which germ layer? And this thing we have studied like many times, my dear friends. When I taught you about the formation of germ layers, the formation of all the three germ layers, ectoderm, endoderm, and the mesoderm, yes, we learned about that. From the primitive streak, the cells will multiply, and after multiplying, the cells will be going down into the hypoblast. And once they migrate down to the hypoblast, all the cells of the hypoblast will be replaced by new cells. And that is going to become your endoderm. So we have written there the sequence of formation of the germ layers. The first germ layer to be formed will be the endoderm. So whenever the epiblast cells are migrating, the first germ layer to be formed will be endoderm, followed by the mesoderm, and then followed by the ectoderm. Fine. So this we have discussed in the general embryology section about the migration of the epiblast cells. The epiblast cells, the primitive streak cells, will multiply and they are going to migrate to the hypoblast. So therefore, my dear friends, please remember, this is already a repeat question already asked in the exams. The sequence of formation of the germ layer. So the first germ layer to be formed will be endoderm, followed by the second germ layer will be the mesoderm, followed by the ectoderm. So the first migration here, the first germ layer to be formed will be the endoderm here. Perfect. Thank you, Dr. Agarwal. Now, these were all the questions which were asked in your INI-CET exam recently, which I have collected from all the students and all. So, my dear friends, I think after seeing all these questions which were asked in the INI-CET exam yesterday, we can clearly see that all these concepts we have discussed very in detail in our main videos also, as well as the rapid revision sessions also. I think once while you are attempting the questions in the exam, you were able to answer all the anatomy questions. Okay. So by this, we are done with this one here, sir. All the questions asked in the INI-CET exam about anatomy has been discussed. If you find any more questions which were missing here, you can always drop a message and in the comment box over there. In the comment section, you can actually drop the message. I'll try to include them, and we'll be uploading all the final questions in the app. Okay. So thank you all. Thank you, sir, for your rapid revision. Helps a lot. Thank you, Dr. Deep Jyoti. Thank you. So that's all, my dear friends. These were all the questions asked in the INI-CET exams today. Thank you all. Signing off here.